thank you so much for that introduction and really for this opportunity to speak with you today. It's really hard to believe that I do have this opportunity. I'm really so honored to have been selected as your distinguished alumni to be able to talk today about a few topics that I'm sure are certainly at the forefront of many of our minds, certainly very topical, and just to share a little bit of about what I do. And let me share my screen. That really did get its foundation at Liggett. And I just want to make sure, can everybody see my screen? Okay.
Yep.
All right. So I will just right now say, I apologize if you can hear sirens in the background. I'm sitting in my office in Philadelphia, and there are frequently sirens going down the main thoroughfare. So I apologize. It'll just be part of the ambiance. But today well, initially I thought that I'd focus a little bit more on vaccines, but certainly there are other things to discuss as well because of the pandemic that we are all experiencing. But to start, I thought I would just talk a little bit about pathway and why vaccines and public health have become a focus, and why I love to talk about them. So I'm a pediatrician and an infectious diseases physician, and I think it really started that pathway. Certainly the spirit of inquiry that Liggett instilled, but shortly after college, I worked for a youth program that was really focused on or centered around public housing communities in New Haven, Connecticut, and that experience really drove home the importance of neighborhood and how where we live can impact our health. And so that really drove me to pursue a career in pediatrics and public health. And infectious diseases, I think, aligns with that very nicely because microbes are everywhere. They're in our environment, they're on us, inside of us, they're everywhere, and they also significantly impact our health, obviously, and certainly are related to where we live, who we are, and how we interact with each other. And so, I'm very interested in understanding ways to create healthier communities, and for that reason have chosen to focus on public health. And so when you think about prevention and healthy communities, we do have many tools that we use, but certainly vaccines is one key and very impactful tool, especially in the world of pediatrics. As a pediatrician, recommending vaccines, probably one of the most important kind of recommendations that we make as an infectious diseases physician. Certainly vaccines are a very powerful tool in our ability to control and prevent communicable diseases. And so, for all of those reasons have really focused a lot on vaccines. And, I will also say that, vaccines have been fascinating, not just because, from an epidemiology perspective, the role that they can play in prevention, but also from a health behavior perspective as well. When you really think about what informs decision-making for prevention tools, vaccines are something that you were asked to accept when you were feeling well, and when sometimes the thing that you were preventing is not, right in front of your face. And I think now more than ever, and I'll talk about that a little bit later, there are, many factors that influence the decision to say yes or no to a vaccine. So I'm going to, this will be a whirlwind, and I'm going to try to get through content quickly because I'm really interested in having a discussion and hearing your questions. But going to spend some time just talking about the landscape of vaccines and vaccines on the horizon. We'll spend some time talking about COVID-19, and then we'll end with a talk about vaccine hesitancy as well. And I think that this is an opportune time to talk about these things because, obviously, COVID-19 is a public health threat that we are all confronting, and vaccine hesitancy has also been cited as a public health threat as well. So, why do vaccines, matter. Certainly as a pediatrician, I think a lot about this. If you consider diseases that have resulted in a lot of illness and death in kids especially, but adults also, vaccines have been very impactful here in the US and globally. If you think about deaths that have been prevented, cases of disease, healthcare costs, certainly a very impactful. And despite that impact, also I think have come under some fire, certainly because of concerns about vaccine safety, number of vaccines as well. But certainly they have been a very impactful tool. And I think generally consider vaccines, or have considered vaccines, something for related to children. Most vaccines that we have are recommended for kids, but this is really an expanding field, and so there are more and more vaccines that are recommended for adults. There are more and more vaccines that are being developed for, utilized for really different indications. And so if you look at the vaccine pipeline, there is quite a bit going on, and I just wanted to share some highlights. There are about 100 vaccine manufacturers worldwide, and so a vaccine, it's a pharmaceutical, like a medication, and so it's going to be made by, at least final parts of vaccine development, really led by the pharmaceutical companies, but there are about 100 of those worldwide. But only about 10, a very small proportion, are really able to conduct all aspects of vaccine development. There is a lot that goes into making a vaccine. So if you look at the total number of vaccines that are at some stage of development, they're about 600, actually, though the vast majority won't make it to production. But there are a lot of vaccines being kind of explored out there. And so, who decides what pathways to pursue, what we get vaccines for? There are kind of groups that do spend time setting priorities for vaccine development. And so, the goal of a vaccine is to prevent a disease. And now in some cases, actually, there are vaccines being developed to treat certain conditions. And so, decisions might consider what the burden of disease is. Do we even have the ability to, identify a target for that vaccine? How costly would it be to develop a vaccine? Would we be able to really introduce it into the, the community that really needs it? So a lot of things go into a decision to make this, a vaccine. And so vaccine development takes a really long time. It takes 10 to 15, sometimes even 20 years, and can cost a lot of money. And the reason why it takes so much time, I'll show you in just a couple minutes, is because there's just so many steps that need to happen. And I think that these steps take a little bit longer because the bar is really, really high. If you think about it, we get vaccines when we, again, are healthy. You need to make sure that any potential risk associated with vaccination are far outweighed by benefits. So the safety bar is really, really high. So as I mentioned, there are a lot of vaccine candidates out there. There are vaccines that are recommended for specific groups. Like there are quite a few vaccines that are being developed for pregnant women. And I'll talk a little bit about that. There are vaccines, of course, that are being developed for emerging infections. SARS-CoV-2, or the virus that causes COVID-19, is one of them I'll talk about. There's some new vaccines in development for diseases that have been around for a long time. There's work being done to improve upon the vaccines we already have. And then another, I think, kind of exciting area is the idea of therapeutic vaccines. And so, we think of vaccines as a prevention tool, right, to prevent us from getting an illness or infection, but there are some vaccines being developed actually for treatment of different conditions. As I mentioned, yes, there's 600 vaccines under development, but again, many of them are probably not going to make it into our doctor's offices. And that is because vaccine manufacturing does take a really long time and it's difficult. And so, it starts, very early on with just some very basic research, right? To really try to find out how you're going to do this. So a vaccine works really by essentially what it's trying to do is kind of train your immune system, right? So it's just trying to introduce or show your immune system a part of, or a weakened version of something, a virus, a bacteria, just so you can activate it just enough, right, so that you can make these antibodies that are going to protect you in case you see the actual virus or bacteria later. And so to do that, you really have to understand a lot about how our body reacts to an infection, which part of our immune system is activated when we get the actual infection, so that you can figure out what kind of little antigen or protein or what you can really use in a vaccine that would give us an immune response and give us one that lasts. So there's a lot of work that goes into just doing that, and sometimes that doesn't go very far, and that usually happens like in academic labs at places like Penn or University of Michigan, and so it happens outside of a pharmaceutical company. Once you've got that, though, once you do identify, okay, I think we have a little target we could use for our vaccine, and you start to put together what the vaccine might look like, then you've got to make sure it's going to be safe, of course, and that it's going to give you some kind of immune response before you start trying it in people. So there's an animal testing phase, and then you go into the human trials, of course. And those can take a very long time, again, because, as I've mentioned, you have to test this in enough people very slowly and very carefully to make sure that the vaccine is safe and it works well. So it can take a very, very long time. So in the end, the majority of candidates, as exciting as they may sound early on, really don't progress even beyond the preclinical stage. So just to zip through a few things about vaccines on the horizon, and I just wanted to highlight these because I think they raise some or highlight some of the interesting questions that I think you have to consider when you are developing and introducing vaccines. And they also, I think, represent different ways for us to think about how we use vaccines. So the first category, so to speak, to start with, are just vaccines for pregnant women. And so, as many of us already may know, during our own, during your own pregnancy, you may have been recommended to receive some vaccines. And so right now, pregnant women are recommended to get a flu shot during every flu season. And they're also recommended to get a tetanus, diphtheria, and pertussis vaccine during each pregnancy. And why those recommendations are there are twofold. One is to protect the mom, especially for influenza. The risk of severe influenza disease is higher amongst pregnant women. And so it's really important to protect pregnant moms during their pregnancy, and it also helps protect their baby. Pertussis, though, getting that Tdap vaccine is really about protecting the baby. And so pertussis, or whooping cough, is an infection that we still do see decently frequently. And the risk of getting really sick is much, much higher in really young babies in the first 2 months of life. And so, as you probably remember with your own children, getting a pertussis vaccine, that's one of the ones that kids get or babies get. But they don't start getting it until they're till about 2 months old. And so if you want to provide them with protection as soon as they're born, essentially, and they're really at high risk of getting the sickest from whooping cough, you want to figure out a way to give them protection, from the time of birth. And so giving a mom a Tdap vaccine, causes her to make antibodies that she can then pass to the baby through the placenta, so the baby is born already with protection. And so this is a vaccine that really is given to a pregnant mom, designed to protect the baby. And so there are a couple of other vaccines being developed with that idea in mind. Group B strep, that's an infection, again, that especially if for moms, you are tested for this bacteria called Group B strep when you're pregnant, and if you're positive, you're supposed to take an antibiotic, and that helps protect your baby from getting that bacteria after the baby is born. And now there's being work done to give a vaccine to pregnant moms as a way for protection, rather than having to depend upon a test and taking an antibiotic. And I think that's just important globally speaking. Fortunately, we do have a pretty robust, screening program here in the States, so that we can screen all pregnant moms and make sure that they don't, to see whether they have that bacteria and give them antibiotics. But that's not the case in many other countries. And so a vaccine would be really, really important in other places. Zika virus is another, I would say, emerging infection, though, but important for pregnancy. And so if you remember, just a few years ago, Zika virus kind of emerged on the scene, primarily in South America, the Caribbean. This is a virus that you get from a mosquito bite. And the reason it raised a lot of concerns is because when women were, if they were infected during pregnancy, some babies could develop an infection, a congenital infection, which would affect their development. And so there's been a lot of focus on developing a vaccine for Zika virus that can help prevent this outcome. And I think here this is a good place to really explore some of the interesting questions you have to consider with vaccine development. And so for something like Zika virus, who should be vaccinated if your goal is to prevent this outcome, this congenital infection? And so in the case of Zika virus, it appears that the highest risk of the baby getting infected is really early in pregnancy, so during the first trimester, so probably before you might even know that you're pregnant. And so as you can imagine, that it might be very difficult to make sure that pregnant women get the vaccine in time. And so would it be more effective to just vaccinate everybody who's of childbearing age, so that you can be immune before pregnancy? But these are some of the types of things that you have to think about when developing and thinking about introducing a new vaccine. So those are maternal vaccines, and I think that's just also this is another an expanding area. Again, focusing on a group or a population for whom we haven't traditionally thought about needing vaccines. So therapeutic vaccines, another kind of exciting area that I'm just going to very quickly review. So, therapeutic vaccines, how do those work? This is treatment instead of prevention. And so, again, as I mentioned, vaccines, they induce your immune cells, and generally, they induce immune cells that are going to target viruses and bacteria. But for therapeutic vaccines, what you do is you make immune cells that instead targets cells that are like tumor cells. And so, whenever you have a cancer, you have these cells that are growing abnormally, they're growing out of control, and they have special kind of proteins on the outside of them. And if you can figure out what those are, you can make immune cells that can target those cells and make them go away, essentially is what the goal is with the therapeutic vaccine. And so there are quite a few vaccines in development trying to do just that for a range of different cancers. And there are also some vaccines trying to do that for autoimmune diseases as well, using a similar pathway. I think that the challenge here is that just you want to make sure that you are targeting something that doesn't look too close to normal cells, because you don't want to have a vaccine that's going to attack normal, or make you make immune cells are going to attack normal cells. So we'll see where this goes. But it's also kind of cool because they're trying lots of different technologies to make these vaccines as well. So there are 2 approved vaccines for cancers, prostate cancer and melanoma, and then there are quite a few under development for lots of other cancers as well, including there's a vaccine being developed as a therapeutic human papillomavirus vaccine. you know, instead of the, this would be something to use alongside the one that's already recommended for adolescents, the preventative HPV vaccine. So those are some therapeutic vaccines. There are also vaccines being developed for Alzheimer's that targets the some of the proteins that are can cause Alzheimer's, tobacco addiction even, which I think is interesting, tries to target the nicotine receptors in your brain that can trigger addiction, and type 1 diabetes. So those are therapeutic vaccines. What about a universal flu vaccine? I thought I would just bring that up only because this is a, well, an never-ending challenge, I would say, when it comes to flu prevention. So, you know, influenza vaccines, we're recommended to get one every year. I bet if I asked everybody on the call to raise their hand if they get one every year, most people probably would say that they, you know, they don't, unless you maybe work in a healthcare setting. And you know, that's because, you know, flu vaccines are, they're a challenge. You know, each year we have to make a new vaccine. You know, their effectiveness, you know, varies quite a bit. Sometimes they work well, sometimes they don't work very well. And so, you know, it would be very nice if we could have a flu vaccine that we didn't have to get every year, and that would, you know, work a little bit better. You know, the reason why we have such a hard time with flu vaccines is just because of the way that they're, you know, made. So, you know, we have this, the vaccine is made by targeting those little yellow, you can see those little yellow areas on the flu virus. There's a certain protein called hemagglutinin, and this protein is the one that our immune system really responds to the best, but it's also a part of the virus that changes the most. And so every year that little protein changes, which is why we've got to get a new vaccine every year. And then this is also, I think, related to just how we make the vaccine. You know, for flu, you've got to figure out a way, for most viruses, virus vaccines, you've got to figure out a way to grow a virus. And so for influenza, you have to grow it in an egg. You have to use these egg cells. And when you grow it in the egg, the virus changes a little bit. And so what happens is you've got these antibodies that work for the vaccine, but they don't look the same as they do for the virus. So you keep getting this mix match. And so what we need to do is find a vaccine that really targets a different part of the virus. And there's quite a bit of work going on trying to do that so that we're not subject to this shift all the time. So that's universal flu. And now I'm going to just turn to emerging infections. And I think this is where we can really turn and start also talking about COVID-19. And so, you know, vaccines for emerging infections, I think are, you know, important and challenging for, you know, a few different reasons. I'm going to skip HIV unless there are questions about it, but, you know, what about vaccines in a public health emergency? And, you know, the challenge with, you know, trying to develop a vaccine when you've got a public health emergency is, you know, you need a vaccine now. You know, you need a vaccine when you're really dealing with a disease. And as you'd seen before, at the very, very beginning, it could take a very long time to make a vaccine if you're going to go through all of those steps. So, you know, what can you do to be a little bit more responsive and move through some of those steps a little more quickly, you know, while still, you know, ensuring safety, et cetera. And so I think a blueprint for some of that really emerged with the Ebola virus outbreaks that took place in West Africa and that currently ongoing in the Democratic Republic of Congo. And so, you know, this Ebola virus outbreak, and I don't know how closely Mueller followed this, but in West Africa, you know, this was an outbreak that affected, you know, many people, high death rates, and you know, this is a virus that can spread fairly easily. And so, you know, a vaccine is really important for prevention. And so there was a work that started right away, you know, during the outbreak. And one was developed fairly quickly within a few years that has been used in the Democratic Republic of Congo. It received approval under an emergency use, was licensed in Europe, and it's been licensed here in the US as well, just at the end of last year. And this is a virus that, a vaccine that used a slightly different kind of technology that allowed it to be developed much faster. And so, challenges to making vaccines during emerging infections, again, as I mentioned, you've got to balance the need for rapid vaccine development with enough time to establish safety. You've got a limited market, so it's harder to get companies to invest in development, right? This is Ebola vaccine was only affecting a few countries. And then you need to think about access. So there was a coalition that was developed right after the Ebola outbreak in West Africa. It was launched at the World Economic Forum, and its goal really was to try to pull together different groups from public, private sectors to really accelerate vaccine development, especially for emerging infections, to make sure that there's investments to help develop these kind of new technologies that you could kind of go to when you have an emerging infection, to also support some of the important things you need to do when you're doing research, so that you protect the people participating in research, that you maintain good ethics in your work. And so, that infrastructure has been really, really important. And been really important because it's been activated for our current outbreak now, COVID-19. So I'll turn to talking about COVID-19. COVID-19 caused by this virus. It's SARS-CoV-2, or severe acute respiratory syndrome coronavirus. And so, this coronaviruses, there's actually a large family of these viruses, and they're pretty much respiratory tract viruses. They affect both people and animals. And there are a lot of coronaviruses that circulate all of the time, that many of us have probably had, that cause upper and lower respiratory infection, often in young children. But there have been some novel coronaviruses that have emerged in the past decade. And that happens when you have a coronavirus that infects an animal that changes enough so that it can then affect people. And when people are infected, they can then spread it to other people. And so there was SARS-CoV that we saw about 10 years ago. There's MERS, or Middle East Respiratory Syndrome, also a coronavirus. And this is one that emerged originally from a camel. The original SARS originated from a small cat, a palm civet. And then this one, SARS-CoV-2, probably was transferred from small mammals, thought to be associated with this market in China, where the outbreak first emerged. But all of these probably have an origin in a bat, really. And so a good example of us interacting with our environment. And so, this virus was first identified, or the syndrome, clinical syndrome caused by the virus was first identified at the end of December, early January, in China, I think, as we all know, and has spread fairly quickly. I think the virus itself was first kind of isolated in early January, and the first case in the US was identified at the end of January. And I would say really since March, it's taken off in the US quite a bit. And so, this has been a situation that has emerged very quickly. Coronavirus, one of the big challenges I think dealing with coronavirus, or this one, is that, we're still learning about how it is spread, how long people are infected. But it is a respiratory virus, so it's spread when people who are sick cough, and when they're in close contact with others. And so, this is a virus also that appears to probably start spreading a couple of days before you do get sick, and up to about 9 days after your symptoms start. And I just point this out because this is from a control perspective, a prevention perspective, this is important. It's much harder to kind of control the spread of an infection when you're contagious before you know you have symptoms. But even so, it really does appear that the highest risk is amongst very close contacts, and so your likelihood of getting sick is higher if you're when your contact is like in your home versus more casual close contacts. So I mean, I have to say, for the past 2.5 months, really COVID-19 has been almost the only thing that I've been doing or thinking about, and I'm sure in many ways it's the only thing that many of us have been doing and thinking about, because it's really just impacted every aspect of our lives in ways that we probably never anticipated. And so, at least from a public health perspective, these are just some of the activities and ways that we've really been thinking about, managing this pandemic. Early on, you really are just trying to focus on containment, because you just want to try to keep the virus from spreading very far. And initially we really try to do this by making sure we aggressively identify cases. Once you identify a case, you tell them to stay home. You talk to that case, you find out everyone they had any contact with, and then you tell those contacts to also stay home, just in case they get sick, so they don't spread it to others. And you need to figure out exactly what your definition for the illness is going to be. And that's really what our kind of hope was initially, is that we really could focus on case finding. But I will say, unfortunately, I think we kind of missed our ability to really do that. And there just were the emergence of too many cases to really be able to do contact tracing in that way for containment. And so when that happens, then you really have just got a mitigation, which means you just want to try to reduce the amount of spread that you have in a community. And that's where we've gotten all of the things that we're doing now, like stay-at-home orders, school closures, wearing a mask when we go out. And on top of that, ideally, you do have some other kind of medical interventions that can help. So being able to treat the infection, and then having a vaccine for prevention. This is a virus, since none of us have seen it, we're all susceptible. And one way to reduce the number of people who are susceptible is by having a vaccine, rather than waiting for everyone to potentially get sick. Especially when the cost of infection can be very high. So at this point, we really don't have a great armamentarium of treatments. There's really just been one antiviral that has been shown to have some effect in hospitalized persons. And we're still, of course, waiting for a vaccine. So hoping that these mitigation strategies can work in some way. So there have been some challenges to containment and mitigation. I think we are starting to see the positive impact of some of all these interventions. But I would say that, at least from my perspective, this whole experience has highlighted a few things. So one certainly is a fragmented public health system. That there have been different places are doing different things at different times, and many of us don't have enough kind of staff, supplies, et cetera, to really do everything that you'd want to do for kind of contact tracing, testing, identifying cases. I think this has been covered widely in the media, but insufficient testing availability for widespread, to be able to find cases readily. I remember at the very beginning when we first started seeing the cases here, we got a call about somebody, and they were worried about, the hospital's worried about COVID-19. We would have, the only test was at the CDC. We'd have to call the CDC. We'd have to talk to their team. We'd have to wait for someone to call us back. We'd have to ship the sample. It took a lot of steps. And so for that reason, we just weren't testing that many people, and we probably missed, some other cases and introduction into the community. At that time, we were focusing on returning travelers from China, but I think there probably was a lot of disease activity in Europe, and we were missing, returning travelers from other places who might have been affected. I think we're still learning about how this virus spreads. And then I think the challenges also include disruption imposed by, some of these mitigation strategies. I think one question that we received before the presentation was just about, COVID fatigue. And I think that certainly is something that we're starting to see in communities. I mean, I can tell when I, go outside, there are more people, despite, we're still under a stay-at-home order, spending time outside. We're starting to, engage in some of their daily activities, because we are, we're bombarded by messages about COVID-19 all of the time. And so I think sometimes that makes it easy for us to start to tune them out in some ways. The weather is nicer. And so I think that's made it a little bit harder to continue to impose some of these things, let alone the economic disruption and all of all of those kind of side effects by these interventions. So in terms of vaccine development, I think that will be part of the next phase of our response. There are 70 companies who are working on vaccines, and clinical trials have begun in people for 3 of these vaccine candidates. And really, this has been something that's happened very, very quickly. So if you think about, this pandemic just started at the beginning of the year. The virus was isolated in early January, and like the very next day, the virus was sequenced, and essentially that allowed people to start making these vaccines. And in order to try to do this faster, they're using some very different kinds of techniques. I think they're cool, but they're essentially what they're doing is instead of, often for virus vaccines, you usually have to work with the whole virus, and you either kill the virus or you weaken it. But that takes a lot of time, while you're learning how to do that, and you've got to grow the virus. For these vaccines, what they're doing is they're really just focusing on a genetic sequence from the virus that makes a certain protein that our immune system seems to respond to the most. And they're just taking that sequence and they're kind of putting it in other things that can be used in a vaccine. So it's not going to be a vaccine that's made with the virus itself. And that just lets you make it much faster. So we'll see how quickly a vaccine is available. If people are thinking maybe a year, or beginning of the year, I should say. So that is COVID vaccines on the horizon in a very, very quickly. So just quickly, implications for implementation. Well, at least I think this is, some of these developments are, kind of exciting when we think about the potential impact for prevention and even management for some of these therapeutic vaccines. I do think we have to consider what this means for implementing and introducing vaccines, putting them into a schedule. Especially if you consider the child and adolescent schedule, it is already quite full. You're talking about new vaccines for adults in different groups. You have to consider quite a few things about how you're going to deliver the vaccines, store the vaccines, communicate recommendations, and then I think we really have to consider acceptability. And that's for patients, parents, and providers. And I think, as I mentioned at the beginning, despite the impact of vaccines, there's always been vaccine hesitancy as well. And due to a wide range of concerns and reasons, and some of that is related to vaccine safety, and especially I think with an increase in the number of vaccines. There are more concerns about safety of this, the schedule, getting a lot of vaccines at once. A belief that diseases are more due to, like a lack of good hygiene or other factors. And so, a vaccine is really not needed. Concerns about medicine and public health, kind of overstepping boundaries. And then also, the kind of sentiment of being your own doctor. And that's been something that's been around for a long time. So there's always been, hesitancy that has kind of impacted the introduction of vaccines really since they were first there or developed. And so, but I think the scene is changing a little bit, and now vaccine hesitancy is considered one of the top 10 threats to global health. And so I'm just going to quickly talk about why I think we're here, and then I'll just open it up to questions so we have time for discussion. And I can definitely stay for a little bit after 1 o'clock. But I think we've come here for a few reasons. And so one certainly is a consequence of success. I think for many parents, pediatricians, you may not have any experience. You haven't seen some of the diseases that are prevented by vaccines, and so you might not feel as much of an imminent threat, or have fewer concerns about the disease risk, and that provides more room for concerns about vaccine safety. And then I think we also just live in a very, very different time. We live in a time of a lot of kind of distrust, really, and especially distrust of public health authority in general, experts. We live in a time of rapid spread of information, and some of that information, I would say, of variable reliability. And it is certainly very easy to get a range of messages and pieces of information about a topic that conflict. It can be very difficult to know what's accurate and what's not. It also can be very easy to find information that supports something that you already think and believe. And so, the way that we kind of communicate and disseminate information, has, I think, really contributed to, a lot of the kind of vaccine hesitancy and kind of questions we've seen related to other topics like climate change, et cetera. And then also, the idea that, natural is better. And there are many ways in which I think we as a society, practice that or think about that. Natural is better rather than, doing something like, using a vaccine to, boost your immune system. And so, this vaccine refusal is not without its impact. I think, hesitancy, and I'll talk about what the definition is, really is just a behavior. It's really just a reflection of, it's a behavior. It's how you decide whether you're going to accept the vaccine or not. And there are a lot of different reasons why you might make that decision. But it's a spectrum. And, at one end of the spectrum, certainly there has been kind of a growth in more vocal kind of anti-vaccine advocacy that has been, quite vocal and has played a role in some of the recent outbreaks that we have seen in vaccine preventable diseases, like measles, for example, the measles outbreak we had last year. But there are examples of, kind of very direct anti-vaccine advocacy in which there were, messages put forth that really, I think promoted, messages that got people not to get their kids vaccinated. So how do people make decisions about vaccines? Again, because hesitancy has become such, a rising kind of concern, there's been more and more work in really trying to think about, well, how do people decide, whether or not to get a vaccine? And I think this, at least to me, intellectually, is what is very fascinating, what makes this kind of a rich field, but also kind of challenging. But there are, again, lots of factors that might drive this decision. And some of the work about this is focused on these kind of three domains. So one is kind of complacency, and I think that's just related to, how we perceive of, your risk of getting a vaccine preventable disease maybe, or, how you might prioritize getting a vaccine alongside other things that are important, to you or important for your family. And so it just might not be prioritized. It's not that you have a concern about the vaccine, it's just not, a priority. Confidence is another big one. How much do you trust vaccine? Do you trust vaccine manufacturers? Do you trust your doctor? And then convenience, and that could just be how easy it is to get a vaccine. If it's not easy for you to get to clinic, or the vaccine is too expensive, et cetera, you may choose not to get vaccinated rather than this being, about, a safety concern. And all of these things are, like anything that we do related to our health is going to be affected by all of these other kind of things out there. So what our own health beliefs are, what our friends and neighbors do, how much things cost, and even, what things we've read in the media, and, even politics and history can all kind of influence these in different ways. So it is a kind of a complex web. And I think then it makes it a challenge when you're thinking about, how to communicate about vaccines, how to design an immunization program that's going to make sure that these tools are available. So I'm going to, I think, stop there, but I mean, I have some more slides I can go through, but I've been talking long enough, and I really just want to hear what some of your questions are.
Well, thank you, Kristen. That was a lot of really interesting and good information. You definitely covered a lot of ground as you promised in our email exchanges. So why don't we do this? I did put a call out for questions yesterday via email, and we did get some, and we are getting some on the chat feature. So I think what I'm going to do is go through the couple ones that I got yesterday first and kind of try to answer everything in order here. And I will start with the first one we got yesterday, which was vaccine hesitancy and under-vaccination is a looming health crisis. There are vaccine hesitant individuals and also a significant group of anti-vaccination folks that are not susceptible to scientific principles or to anything else that a physician might say to convince them otherwise. Are there any tactics that have been shown to be more effective for these types of groups? Like to convince them to get vaccinated?
I should probably, I'm going to stop sharing my screen right now. Yes, so yeah, that's an excellent question. And I think that, communicating with persons who have really staunch, firmly held beliefs is challenging. And I think, generally speaking, addressing hesitancy, we are learning more and more about, what works and, what is more effective. And certainly there's evidence that, as you pointed out, that providing information alone is not always going to be very effective. I mean, sometimes for some people, just being able to address some, common concerns is, does work. But, I think for, really firmly held beliefs, we don't know the best way to, effectively kind of address that, because that's a belief, and it's much harder to kind of change a belief. And so I think in that case, I think it's important to try to understand what's kind of motivating that belief, and what might be, to try to figure out a message or a way to make vaccination or kind of acceptable within that those beliefs, if that makes sense. As a quick, just a brief example, quite a few years ago, we did a study looking at acceptance in different communities. This was in Botswana, but there was one, overall, most people in Botswana are fairly accepting of public health recommendations and vaccination, but there was one group in particular that really, did not accept any vaccines and didn't really accept most medical interventions. And so the nurse who was working with that group, and this was mostly based upon religious beliefs, tried to frame the ability to develop vaccines and other medical interventions, within that group's religious beliefs. So I think it's spending some time and trying to understand what motivates beliefs. But otherwise, I don't think we have a great answer for that.
Okay, so the next question is, I wondered, and you kind of touched on this a little bit, I wondered if we could ask about COVID fatigue and how long a society or community can emotionally handle being distanced from so many things that gave their lives meaning. You know, have we reached that point after 2 months, which might explain some of the protests at the Capitol?
I, yes, I mean, I do think there is definitely COVID fatigue, and I anticipate that we will see more as we approach summer, for all of the reasons that you brought up in your question. I think this has been a difficult anxiety provoking time for for all of us, and we cannot get away from, you can't really get away from it, that you're hearing about COVID-19 on all fronts. And yeah, and again, I think as everything else starts to look brighter, like the weather is better, that I think that some people will start to really push against these stay-at-home orders. And so I think this is a big challenge. And I think this is similar to some of the things that we see with vaccine, some vaccine hesitancies. This is we're asking people to make a decision or to do something that can protect them, right? Because they're staying at home, then they're not going to be exposed to COVID-19. But it's also an action that affects other people, and so and sometimes there's a tension there, and it's it can be difficult to always motivate action that doesn't seem to that is about protecting others, and feels more difficult to do yourself.
All right, so we have another question. It says, "Hi, Kristen. I'm very excited to be able to participate. My question is just asking you about your thoughts about the inflammatory disease affecting children as be related to the COVID-19." And then this person says, "Love you, Heidi."
I know who that is. Yes, so there has been a recent, recently in the past few weeks, there's been the emergence of this inflammatory syndrome that appears to be associated with COVID-19 in kids, and it looks similar to another syndrome that has been described in kids that may be triggered by other infections. And so right now there's a lot of focus on learning more about this, and actually just this week there was an alert put out by the CDC, and we actually are adding this to our reportable disease list. But we're trying to make sure that we, when doctors see these cases, that they call them in and report them, so we can just learn more about them. But it's been seen primarily school-age kids, but we're looking for it in anyone under the age of 21. We don't know enough about it to say whether there are any specific risk factors for it. I mean, overall, kids are more mildly affected by COVID-19, for sure. And kids who are become more severely ill tend to have, other chronic conditions. But yes, we are trying to learn a little bit more about this.
Okay, so now I'm going to go to questions in the chat here, and I'm just going to go in order of receipt. Here is one question that says, if HPV vaccines fall under the therapeutic category, meaning treatment after the fact, why are doctors pushing for young girls to have it done before a certain age without showing any signs of the disease?
Well, the therapeutic vaccine has not been introduced or licensed yet. So the preventative vaccine is the only one that we have available. And, I think that, at least to me, as a pediatrician and as a parent, I think the most important thing we can do is to prevent infection before it happens, so that you don't progress to, getting cancer. And so the goal of the vaccine program now is to, vaccinate teens before they become, they can be exposed to the virus, so that they don't develop infection that can then lead to cancer. And so, I think the idea behind having a therapeutic vaccine may be for, adults who have not had an opportunity to receive the preventative vaccine, so that they have an option to treat their cancer. But ideally, the goal is to be able to prevent first. And if you can do that and do that effectively, then we'll have fewer cancers that we would even need to treat in the first place.
Yeah, good point. Okay, so the next question is the current hydroxychloroquine clinical study considered an attempt at a therapeutic vaccine?
And so hydroxychloroquine is a medication that is being evaluated for treatment of COVID-19. And so hydroxychloroquine is a medication that's been used, that is used for malaria and other, it's been used for other infections and conditions. And there was some early indication that it might help for treatment for COVID-19. And so that's what but it's not a vaccine, it's a medication that's being evaluated for COVID-19.
Okay, here's the next question. It says, if people are infecting so many pets with COVID-19, why are the experts saying that pets cannot affect people? I'm not sure I totally get that question, but I guess, can you just speak to sort of the relationship between pets and humans?
Yes, so that's a good question. I have to say that I don't know as much about this area, but there have been some kind of concerns or reports that the COVID-19 can affect pets. And so if that's the case, is that a way that the virus can spread to people? And so I don't know of instances where people did get the infection because of exposure to their pets. And it just might be related to how much virus a pet might have, or there might be some differences in, in the way that it would spread from a pet. But I don't know as much about that. I can try to get more information though and share it later, but.
Yeah, I mean, there might be some interest. I'm sure there's stuff out there as well about the pet relationship. Okay, so the next question is, more broadly, as a person of stunning accomplishments and competencies, what thoughts would you share with younger alums about how you so fully developed your own potential? I.e., what do we all need to do to be as awesome as you? Not that I'm a young alum, but.
Well, in many ways, I would say, one, be open to just being, open to, kind of experiences and pathways, because I would say, if I look back, where you think you might be going, like when you graduate from high school or college, is not necessarily where, I've ended up now. And I wouldn't do anything differently at all. But I think a lot of it has just been from, choosing opportunities or experiences will, lead to where I'll learn something new, and that it might lead to, kind of a next step or a new opportunity. And so I think getting experience related to the things that you are interested in, and just being open to, trying something a little bit different that you wouldn't necessarily have, thought that you would have done, is one, I think has been an important part of the pathway. And be ready for some serendipity, just be ready for a path to, meander a little bit, because that's when opportunities happen.
That's true. Okay, the next question is, can you please elaborate on the antiviral method being used by the medical that is proving to be effective?
Yeah, so this is in reference to this is for COVID-19, I'm guessing, for the so there's, so there have been quite a few different medications that people have been trying to treat COVID-19. And so there's one called severe that was recently given FDA approval for treatment, but specifically for people who have pretty severe infection, so that they're hospitalized. And so that's what the medication is. There isn't anything yet, to give for treatment to people with milder infection, kind of like Tamiflu for flu. We don't have anything like that yet for COVID-19.
That's too bad. Okay, so then this question is, please talk a bit about STI 49. How long is it protective once it's in our body?
STI 1499.
Okay, so this is my question. Let me just clarify. So this morning I read about this pharmaceutical company in California. They came up with something called STI 1499, and it's just antibodies.
Yeah.
And they're saying it's very promising. I mean, the person can get better in 4 days. So, but they also are saying that it's not, possibly it's not valid for a long period of time. I was just wondering if you heard anything about that, and just to comment a little bit more.
So that's a good one. So I haven't heard a lot about this intervention. I do know that people are using convalescent plasma, so plasma from people who've recovered, presumably because they have antibodies, and that's shown to have a impact. And so, so this is probably a type of, passive immunization, really passive immunity. So you're providing antibodies already. And generally when you do something like that, those antibodies don't always last very long. So, you have a good, so it might work well to try to treat the active infection, but it won't necessarily mean that you're protected for always. And I think and until we know more about how our body does respond, what the immune response really is and how long it lasts to this virus, it's going to be hard to know how long something like this would be protective. But generally, when you give somebody antibodies, those antibodies don't last very long. The ones that are more durable are the ones you make yourself, generally, if that makes sense. So,
I'm sorry, I don't mean to just take a little bit more of the time that I'm allotted, but is it possible if you introduce those antibodies from somebody else that your body will start to learn from that and make it itself?
So not necessarily, because you're already kind of getting the antibodies. And this is kind of a difference between active and passive immunization. So when you make your own antibodies, you have to kind of turn on the cells in your body, your immune cells, the B cells that make the antibodies. And if you just receive antibodies from somewhere else, that stimulation part doesn't happen. So it's just a little bit different.
Okay, thank you.
That's a good question.
Okay, so here's the next question. Oops. Is when vaccine creation normally happens in 10 to 20 years, how realistic is it that we'll have a vaccine in 1 to 2 years? And what will that mean for us practically until we have a vaccine, i.e. is the safest way to stay home until then? And then he wrote, following up on that question, when we aren't anywhere near a vaccine, won't this start the process over again?
Yeah, so I think all of these questions are the ones that people are grappling with the most. So for the first part, how realistic is it that we'll have a vaccine? So certainly so I think there are a couple of things that are a little bit different about the pace of this COVID-19 vaccine development, such that we might have a vaccine in 1 to 2 years. So, some of the steps that can take a long time have been able to happen really quickly. Like we've already figured out, they were able to kind of figure out a target for the vaccine fairly quickly. And then they're using these different technologies that don't take quite as long to develop. So I think those two things help accelerate this vaccine development. And then, one of the other things that you need to do, of course, making sure that the vaccine is, safe, but the effectiveness part, knowing how well it works, that means being able to see, how good it is at preventing infection. And because we have a lot of COVID-19 going on right now, it'll be a little bit easier to answer that question. But, it's really hard to say. I want to be optimistic that we'll be able to have a vaccine, faster, fairly quickly, but we just won't know yet until we have more time to really see how well these new vaccines are working in terms of the antibodies that they make, how long those antibodies last, because that's what you're going to need. And so we might not have a vaccine. I'm hoping we will, but we might not. And so what will that mean for us practically? Like, we can't all stay home forever, right? So I think then we have to continue to utilize other mitigation interventions. And so it's not that we necessarily have to stay home. I mean, like, overall, even if we don't have a vaccine, the number of, because infection is moving through a community, the number of people who are available to be infected by that virus is going to go down. So, the numbers are going to go down, whether or not we have a vaccine. A vaccine would just help those numbers go down much, much, much faster, and without us having to, experience having as many sick people. But the virus is going to run out of places to go. And so, we should start to see lower levels no matter what. In the meantime, I think we've got to continue to do what you always do to try to prevent viruses from spreading, staying home when sick, washing our hands, probably going to have to do some more mask wearing for much longer, distancing, even if you're leaving the house.
All right, good to know.
Yeah.
What kind of masks should we all be looking to get these days? Fabric ones are just fine for most of us, right?
Correct. Fabric masks are fine. Yes, fabric masks are fine.
Okay. Okay, so the next question is, I don't think Kristen touched on challenge trials. Does she consider them ethical? And if used, what could the impact be on COVID-19 vaccine and the development or the vaccine development timeline?
That's an excellent question. Yeah, challenge, I think right now for COVID-19, a challenge trial would be really difficult to justify, only because we don't, it would be a way to get an answer faster in terms of how well the vaccine works. But, to make someone sick with a virus when we don't have a clear way to manage or treat that person, I think makes it harder to justify doing a challenge trial. It's different when you have a condition for which you have a clear treatment. You have something you can, definitively do. But, this is an infection that we're still learning about. So I don't think challenge trials are going to be used for this vaccine.
Okay, so the next question is, I'm very concerned about the fact that now doctors are discovering much severe consequences from COVID-19 in children. What is your take on what schools' policies should be to protect them?
Yeah, so this is this inflammatory syndrome, and whether schools should, I don't know if this is a reference to remaining, school closures or what, so even there with this emergence, this emergence of this inflammatory syndrome, is, it certainly is concerning as evidence of the potential for severe infection in kids. Overall, this still probably represents a pretty small proportion of kids who may have been infected, by the virus, and overall they, haven't been as affected as adults. So, I think we still need to make sure that we consider protecting kids. I don't think we can say that, well, kids don't have to worry about this infection at all. And so I think similar to other, community locations, I think schools, I personally think it's going to be important for schools to reopen, and that they do things that we're asking other places to do in terms of, maybe setting up classrooms a little bit differently, promoting hand hygiene, just other things to help, keep the classroom safe.
Okay. Yeah, I hope we can open up school in the fall. Okay, so we've got, actually, we do have a young alum on the call here, and she is studying public health in college, and she wonders what some of the key takeaways are that she should take from kind of in general as a public health student.
Yeah, I mean, I think there are so many lessons learned related to this. Really seeing a pandemic unfold in real time. Just last year we revised our pandemic preparedness plan, and I never would have thought that we would be implementing it now. And so, I think there quite a few things. I think that as a public health student, that it really does. Well, some of the things that I think I have a lot to say on this topic. But one of the things that I think have really been highlighted by this pandemic, and is some of the challenges, and just really considering implementation of recommendations and guidance. And so there's been so much guidance, right, that have been shared, and guidance that changes every other day. And sometimes I think that the guidance that has been put forth is a little more feeling like we've got to say something and do something without always thinking about what it truly means for implementation. And so when it's part of you have to think about implementation, because otherwise your policy is going to be confusing and it's not going to be effective because no one's going to be able to do it. And so I really think implementation is an important consideration. I think about that a lot related to some of the, the stay-at-home orders, especially in a large, diverse city, where, staying home is easier for some families than others. And so, it's really just, I think, I heard someone use the word kind of X-ray, put like an X-ray, just really highlighted, disparities that we have, longstanding disparities that have, haven't really been fully addressed, have really just been highlighted during this pandemic. And so, you think you really have to consider implementation. If you're going to make a recommendation, think about how it's going to be carried out, and that should always be a part of your plan.
Okay, we have one more question, and then I also have a question that I'll ask you after this one. I think actually you covered this in one of your first slides, but the question is, where are the majority of vaccines manufactured? To your knowledge, what is the percentage of vaccines manufactured in the U.S.?
So the majority are manufactured by the really large pharmaceutical companies, but they're not necessarily all here in the, so generally, especially for a vaccine, you've got to build a whole new setup. You have to kind of make a vaccine production plant that's, separate from, where you might make other things. And that's because you have to make sure there's no opportunity for contamination, et cetera. And so sometimes those are set up in other places. So I do know some companies, their production happens in Europe, or, so it's not necessarily all here in the US. So it varies, but I don't know exactly what proportion or percent are truly manufactured here in the US. Quite a few, there are places just outside of Philly that manufacture vaccines, but.
Yeah, I think they're going to manufacture some in Michigan too, or a little bit about that. Okay, well, so my question for you is, we are planning to honor you as our 2020 Distinguished Alumna in the fall. Now, we've had to bump it. What are the odds that we would you as our distinguished alum, and then here we are in the middle of a pandemic, for God's sakes. But we're going to bump it to the fall, which we're all looking forward to. What do you think the likelihood is? I know you don't have a crystal ball in front of you, but what do you think the likelihood is that we'll be able to do a big event like that in the fall? We're kind of planning, to do it at this point, but obviously we would never endanger people, and we'll do whatever is good for public health.
That is an excellent question. And I wish I knew. I want to say, it's so funny. I feel like I have, I think we are definitely, a lot of people are anticipating there's probably going to be a little resurgence in the fall, for a variety of reasons. As we step back from some of these mitigation, interventions, we'll probably see some increase in transmission. Fall is respiratory virus season anyway. but I don't know if it will be enough to prevent us from, re-engaging in, more social activities, especially if we're maybe taking some measures to do it. So like maybe there'll be fewer people in this room, or, we might have to do it a little bit differently.
Yeah.
But I don't know. But yeah, I feel some, like like on a personal level, like as a parent or I just want everything to go back to normal, honestly. Like sometimes I'm saying I cannot wait, like COVID-19 needs to just stop. I want
Yes.
kids to go back to school. I want to go to a restaurant. I want to go, I want to see my friends. But, from a public health perspective, like, no, we have to take this seriously. This is it. So, I don't know. But
I know. Well, don't worry. We'll do whatever is, guided by our governor and those.
Yes, and of course.
We obviously won't make those decisions for a couple more weeks, if not a month or two from now. But I just wondered that. I know when we talked a couple weeks ago about all this,
Well,
I
I think
the fall will loosen up a little bit.
Yeah, and I think we'll learn a little bit more. There's been more discussion about antibody. I think we'll learn a little bit more also about, how many people might have been exposed and infected with mild symptoms or no symptoms, and then have some protection. There are more of these. There are going to be more studies looking at the, evidence or prevalence of prior exposure, and I think that might also help us because we'll have a better sense of like how much. What proportion of a community might already be protected.
Right.
And that will help us understand what risk might be as we engage.
How confident are you in the numbers right now? Like based on the fact that not everyone's been tested necessarily and some people are asymptomatic,
Yeah, I'm sure that we are missing a large number of infected people for those very reasons, because our messaging has also been, if you have mild disease, stay home.
Right.
And
so
then
you don't get tested.
Yeah, and there are a lot of people who've been asymptomatic. There are definitely some published, there's, examples of people who've done testing in places like long-term care facilities or shelters, and seeing a large proportion of asymptomatic people who are positive. And there have been a couple of studies and some small community studies like that too. But I could imagine it could be up to like 10% of the community could have been infected without, knowing or without having been tested.
Mm-hmm. Wow. There's just so much to talk about with this topic. We have one, let's see here.
Yeah, and I feel that we could have spent the whole time talking about COVID-19, but I was thinking, because of COVID fatigue, I would talk about some other things too.
Yeah, no, we're so glad that you did. We have one question here for Bart, who I'm not sure if he's still on the horn here, but it's, are you still a Phillies Eagles fan or a Lions Tigers fan? But he may well have stepped off because I know he had a meeting like at 1, I think. So, and it's already 1:24. So I'll make sure that I'll forward that question to him. Oh, it's for Kristen. Okay. Oh, is she?
Oh,
for you?
Yes, I will confess we've been in Philly since, oh my God, 2002. I am still a Detroit sports fan for sure.
Oh, yeah, that's right. You better be. This person wrote yes. So good. Sorry, I screwed that up a little bit. I thought it was for Bart, but well, that's good to know. Good to know. We know where your loyalties lie.
Yeah.
We may have had to reconsider the Distinguished Alumna. That wrong.
Detroit's the best.
Well, thank you so much. This has been incredible, and you are wonderful to have prepared it for us. I will say that we did record this, and we will probably have it available at our website for people that want to look at it. And then earlier, I got a question from someone wondering if the materials that you shared with us, which obviously will be part of this recording, but would they be available, for us to distribute or get out there in some way?
Yeah, sure, absolutely. I'm happy to share the slides. I had a few more on immunization requirement. There are a few more towards the end as well, but I'm happy to share the slides.
That'd be awesome. So we'll figure out how to get those out there, and they'll obviously be part of this recording as well. But we can somehow get that either at our website or something. I'm doing a Nightline News on Thursday, and I'll probably to this at that time. So getting a lot of comments here that say thank you. This was informative and interesting, and we're so grateful to you. If we were here in person, I would give you a little bag of University of Liggett swag, but I'm going to have to put that in the mail. So keep your eyes peeled for that.
Thank you so, so much. Thank you all for joining the discussion, and thank you all so much. This was really fun.
Yeah, this was really great for all of us. So thank you very much. And
So nice.
in touch about the fall.
Yeah, it's so nice to see all these faces, but yes, absolutely. All right. Bye, everybody. Have a great day.
Thank you.